They only come for fun. I want to know gender, I want to know. Those are not the real issues why scans are done. It is recommended that in every trimester, a scan is necessary.
Hello there. What comes into your mind when you hear of a pregnancy ultrasound scan? To most people, they'll think of a gender reveal scan. I'm your host, Nicole Margaret. This is the Health Wing, where we help you stay happy, healthy, and strong. And today, we are going to elaborate more about pregnancy scan, why it is done, what it is, and why you should do it. Yes, when you go for an ultrasound, the person you get there is called a sonographer. Today we are so lucky that we are having one of the best sonographers in Kitui County. I'm not going to introduce him. I'm going to give him the honor to introduce himself. So, Daktari, neza jintroduce.
Okay, asante sana.
Welcome.
My name's Stephen Mitambo. I'm stationed in Mwingi and I've been here for the last 30 years.
Wow, 30 years, that's a lot. So, Daktari, today we want to know more about ultrasound. You can at least explain what an ultrasound is for those who do not know what you're talking about.
Okay, ultrasound is an examination whereby we use sound to image organs of the body. That is of the human body. Specifically for pregnancy or pregnant women, we call it obstetric ultrasound. And when we talk of obstetric ultrasound, we divide it into three. Pregnancy is divided into three. We call them trimesters. So there is the first trimester, second trimester, and third trimester. So each trimester goes for 13 weeks. So from first week of pregnancy to the 13th week, that is first trimester. From 14th to 26th, that is second trimester. Then from 27th to the last, that is 40 weeks, that is the third trimester. It is recommended that in every trimester, a scan is necessary.
So in full time, you should get 3
At
scans.
least minimum of 3. But they can as well exceed 3 if need arises. Because if a patient has some complications, there is no limitation. You can do as many as possible. But for routine purposes, you are only required to be done at least 3 per every trimester.
At what stage should you have your first?
Okay, the first trimester is done after the 5th week. And the purpose for that scan, one, is to get the site of implantation. I have to state here that the real purpose of a scan is safe motherhood. Safe motherhood, that is safety of the mother, safety of the baby. So we want to establish whether there is safety. Actually, what we are trying to do is to reduce maternal deaths and neonatal deaths. So that is why scans are done. Unlike what people think, they only come for fun. I want to know gender, I want to know. Those are not the real issues why scans are done. So a scan in the first trimester, we look for the implantation site. How is that assisting in the safety of the mother? Sometimes the implantation can be in the tube. If it's in the tube, we call it ectopic pregnancy. It cannot survive there, and the mother will die. If it bursts, the mother will die. So by establishing whether it is in the right side, that one, the safety of the mother is guaranteed. Number two, it could be a multiple pregnancy. So when we talk of multiple, it could be maybe twin or more than one. So we know at that early stage we are dealing with twins and they are in the right place, or we are dealing with triplets and they are in the right place. Number three, at times the mothers are not sure of their days. So if you do a scan at that early stage, it will give you the exact date, and it will be now very easy to time that pregnancy. We have some mothers where maybe they have problems with their menses, so as a result of that, they are unsure of their day, or maybe they were on contraceptives. So because of that, there is confusion. She is not even sure of the day. So if you do a scan within that first trimester, it will now give the doctor and even the patient some clear picture of what is happening inside. That is the first trimester scan.
So that is the scan that gives the accurate due date.
Yeah, that is the most accurate.
Because most people will hear them say that their scan iliwadanganya about the due date. So ni venye walikuja kuchelewa.
Yeah, you see, when we are talking of dating in scan, in the scan, it's based on the body parts. You take measurements of the body parts, and those measurements corresponds to certain pre-planned in the computer. So it will compare with that. But now, depending on the body size of that baby, some babies are too big, others are too small, so it can as well mislead you. But at early stages, it is the most accurate.